Thanks for joining today's session on strategic giving in response to COVID recovery. Just wanted to introduce myself and the panelists, and then we're going to go ahead and jump in and have I think what will be a very fruitful, rich conversation as we look ahead to the discussion around COVID investments long term. So again, I'm Qadira Harris. I am the Senior Manager for Disaster Giving and Grantmaking for Walmart. I'm joined with leaders from across the country who have been on the front lines of giving and investments in communities since the pandemic impacted the US. We've got Wendy Burton, who's the Senior Director, Community Philanthropy, Communities Foundation of Texas. We have Ashley Kopplin, who's the President and CEO, Greater New Orleans Foundation. We have Patricia McIlreavy, President and CEO for the Center for Disaster Philanthropy. And we have Ashley Owen Brundage, who is the Senior Vice President, Community Impact United Way, Dallas. So I want to jump right in. Again, the conversation is very timely as we look at how the country is starting to shift from this immediate response to recovery for COVID-19. And Ashley, if I'd like for you to start us off by talking about some of the trends that we're seeing as around the funding requests as we move into this recovery stage. What are some of the trends that we're seeing?
Yeah, we know that longer term needs in the community are going to be pretty similar to those that we identified in pre-COVID times, only greatly exacerbated by the health and economic crisis that was created by COVID. There's going to be a need still for employment, education, healthcare, but those have just been compounded during this time where many people have lost their jobs. It's taking companies a while to recover. Some jobs won't come back online, and people haven't been taking care of themselves during this time. Any kind of chronic condition that they had, even dental appointments that they had, people have been scared to go and do those things. And so we're just seeing everything is worsening as this time goes on. People are experiencing unemployment at higher rates, and a disproportionate amount of those jobs are held by African American and Latinx folks. And so we know that there is going to be a trend to get people back into jobs and to provide skills training so that we can get them into living wage jobs. To help prevent this type of economic crisis, hopefully from happening again. We're also seeing a great need to support our undocumented families, especially here in Texas, where they haven't been able to access the funds that have been provided through CARES Act. In many cases, they're struggling with basic needs and have a fear of reaching out for assistance right now. So how do we get them the help that they need to help them recover and rebuild after this? So I think there's going to be a real fear too about trying to recover from the educational loss that has happened over this time. So with schools shutting down, and then the natural summer learning loss that has occurred, how do we kind of ramp kids up and teachers up to recover from all of that's happened, especially with the fear now of schools not opening or more virtual learning happening during the fall.
I think we lost our moderator.
I think we did too.
Yeah.
Patty, do you want to jump in? I think you had the next question about communities of color.
Yeah, thanks, Wendy. I feel that, Ashley, I mean, it's so outlaid so many of the important critical issues and trends that are happening right now. And, of course, all of the COVID-19 pandemic is exacerbated. There's a vulnerability accelerator happening at the moment through COVID-19 for items like racial injustice as well. And we're just having to look at how do we deal with all of these issues at the same time. And in a way, I feel it provides us an opportunity to really question our approach, to really question how much we have been part of the solution, the long-term solution, the long-term recovery of communities. Why are these communities more vulnerable than others? And what can philanthropy and implementing agencies who are helping and are close to these communities do to change that? And in some ways, I mean, it's horrible to see a silver lining amongst all the pain that's happening at the moment. But there is a little bit of a silver lining if we only will pull on it and really take it forward and change how we adapt and how we work. And so one of the things that we're trying to do at CDP, and I know a lot of other organizations, including some of your own, have made pledges to this effect, is we promise to lead different, to listen differently, to actually listen, to follow the lead of the communities of color, to really explore how do we take more risks ourselves and get funding into the hands of organizations that are led by the communities of color, Black-led organizations. Stop thinking we know the best way to fix things from afar, but actually turn to those communities and say, what do you need? Because especially in disasters, I think we often know, well, I know what you need. You need shelter, you need food, you need water, you need education. But interestingly, at this moment, we've discovered that some of the organizations that are coming to us for assistance are saying, no, we need help with census registration. We need help with voter registration. We need help with training on us for our small businesses. It's very different than you might have thought. And I feel that that's why it's really critical for me. What is the most important thing for us to do in terms of addressing longer term inequalities is listen to those who are actually suffering from them and to actually explore how they have the solutions in mind and how do we get the funding to them to actually practice that, to find those solutions and to move it ahead. And I think that's going to require us to make those long-term investments. It's going to require us to listen, to take those risks, as I said, to give more, to give later, to allow that sustainability. And we talk about funding local, but I don't know how much we actually practice it as much as we'd like, because it's hard, it's difficult, and it's not always easy. I mean, let's be honest, when you're looking at how to fund in a big crisis like this, you want to be able to give out lots of money in smaller chunks. We all know that's how foundations, philanthropy, that's how we work. It's get the money out, get it out quickly. But working with local communities, really, it takes time, it takes effort, it takes patience, and it takes, as I said earlier, owning some of the risk and expecting that there may be some mistakes made and being okay with that. And I think that's a space for us to learn as a community. And I really am I'm hopeful that we're going to get there. One last comment I would make about this is just organizational mission is really critical right now. And people are saying, stay on mission, stay on mission. But I think we do need to challenge ourselves a little about how we interpret our mission. And are there ways that we can be a little bit more flexible in how we give and how we explore, who we work with and how we work. Maybe I don't see Qadira coming on. So I'm gonna turn this over to Andy. Maybe if you could talk about what advice you would give related to the long-term investments. What are you guys doing in New Orleans to kind of take things forward for your stakeholders and clients?
Yeah, thank you, Patty, and good morning, everybody. One of the things that we learned after Katrina is that a disaster doesn't create inequities, it just exacerbates them and exposes them. And I think that the pandemic is no different. So it should come as no surprise to any of us that our African-American communities, our Latinx communities are having disproportionately negative impacts relative to others. And that is something that we found during Katrina as well. And my analysis of that, just simply put, is that it takes a lot more money from philanthropy to address historic inequities that have been generations in the making. And we ought not shy away from making substantial investments and acknowledging it. The fact is that everybody is at risk from the pandemic. The virus doesn't discriminate against any of us, but it's much more likely to have adverse effects in multi-generational households, where there's less space, where you have lots of frontline workers, as Ashley indicated, who may be taking more public transportation and exposing themselves to greater risks. And so we have to acknowledge that in everything that we do. In terms of the response, and I think that Patty described it well, philanthropy often raises money and comes in quickly at the beginning when government is not positioned to respond. But as soon as the machinery of the government gets rolling with testing and contact tracing and those things, philanthropy needs to step back and then look towards the long term. And so one of the things that we've learned over the years of responding to disasters here is that we have a disaster strategy that says we're going to spend no more than 60% of the money we raise in immediate response and reserve 40% for those longer term opportunities. And this is where, you know, again, with compliments to Patty, where thinking about what underlying strategies that we're going to use to address inequity. So can we fund the strengthening of our federally qualified healthcare networks that are in community that need the resources that can be the front door of access to healthcare services in our communities of color? And that's an investment that we've made that hopefully will pay off in terms of short-term response to COVID, but long-term health equity work to make sure that the community is a stronger community when we're through with this pandemic than we arrived at it. And so I think those are some of the things that we think about. Again, you know, what are the structural opportunities that we can use to address head-on the challenges that the pandemic has exposed? So it could be upskilling hospitality workers, improving healthcare access, improving housing and transit options, so that folks can be in a better position to succeed in all aspects of their lives as a result of the investments we make now. And I see our moderator has come back. So Qadira, welcome back. And
thank you.
I'll turn it over to you again.
No, and thank you for that. Yes, of course. The timing of it, my entire computer shut down. So thank you all for moderating. You know, I understand you all were discussing around, you know, some of the things related to inequities in communities of color. I think the other, I want to pivot a little bit, but I think there's this continuation along those lines around, you know, organizations overall and their sustainability, right? COVID obviously has exposed inequities in communities of color. You know, it's shown the vulnerability in smaller nonprofits. And so let's have a little bit of conversation around, as we think about funding long-term investments and funding COVID recovery, how can we direct organizations that are in the funding space to potentially help with some of that sustaining organizations for the future? Because what we know is that there are a lot of organizations that are going to be closing their doors or on the verge of closing their doors. So let's talk a little bit about how we potentially, as we look at recovery investments, might be able to help some of that. Wendy, do you have thoughts around that?
So one of the things that we recommend, and we have been thinking about it, and it's hard because I think on some hand, there's not enough philanthropic dollars to keep everyone afloat and everybody whole. I mean, there just isn't. What we've been really encouraging our funders, so Ashley and I have been a part of leading a group of about 30 to 50 funders who've been coming together to share a common application to push out emergency funding. And now we're in the process as a group of funders of talking about what's next from our recovery funding and what does that look like as we move kind of past the immediate emergency phase. And one of the things that we've been really encouraging our fellow funders to do is to think more about just open operating grants, not programs that are really tied to a lot of really program specific funding, taking maybe your existing programmatic grants and converting them into operating. And the message is, do we trust our nonprofit partners to do the right thing for themselves and their communities? And they are going to know better how to spend that money, where it is most needed for them and for their clients, for their programming, for their staff, for their volunteers, than we will. And so we need to some extent, just give them the money and the running room to be able to make the right decisions for themselves.
Mm-hmm.
And one of the interesting things that we've done on that general operating support call is we've called on our fund holders as well here at the Greater New Orleans Foundation. So in addition to the grants that we have the discretion to make out of our disaster fund, we've shared that same message with donor advised fund holders, and they've risen to the occasion. We've given out twice as many grants and about almost double the money that we had in the 3 months from March through the end of June as we've done the previous year. And you've seen that actually, you know, community foundations around the country, because people have heard that message that Wendy just gave, which is that the most important thing we can do for a nonprofit is to give them the cash liquidity that they need, just as the small businesses are needing liquidity. And so we've been pushing that message. The other thing is that we're setting up a fund around mergers and partnerships, both through training through our nonprofit leadership and effectiveness work, and encouraging nonprofits. We did a survey of the nonprofit sector right at the beginning of the pandemic, and we were not surprised that 43% of nonprofits were on the front lines of fighting the pandemic, but about 3/4 of them were looking at significant financial stress because of canceled fundraisers, losses of work that they had contracts that were pay for service. So if you're not doing the service, you can't get paid under the contract. So we're looking at significant financial hardships. 23% of those nonprofits we surveyed were open to mergers and partnerships because they can see down the horizon that this recession, while folks may have had the resources to jump in there and support them in the short term, the long-term prospects, if we continue this recession, are daunting. And for us to save those organizations, their staff talent, their resources, their know-how, we need to figure out whether there's opportunities for consolidation that might actually produce more robust, more resilient, and stronger agencies for our communities. And so that is our hope. As difficult as that process may be, we've seen it a couple of times with mergers that we've facilitated. And again, at the end of the day, we've ended up with no loss of service, but a stronger agency providing those services where there were two weaker agencies in the preceding months.
We've also made a significant pivot, and I'm going to look at Ashley too, and we've talked about this around capacity building and really what does it mean to increase, to invest in nonprofits. I think it goes to what Andy was saying around building a stronger agency. Can we help them with financial planning? Can we help them with thinking about their staffing and their, improving marketing and communications and looking at their fundraising strategies and all the things that often nonprofits don't have extra money sitting around to go hire a consultant to go do or to go take care of because they're busy. And we feel like investing in their growth is also a way to help build their resilience and to really help strengthen the whole sector.
One of the great things going on in Dallas is we've got a collaborative of funders that participate in what we call the Better Together Fund, which funds collaborations and mergers. And there's about 5 of us that come to the table there and pool resources. And in, I want to say May, released a letter to just kind of remind our nonprofit sector that we are here as a resource if you are starting to explore or thinking about a formal collaboration or even all the way to a merger. Like, come and talk to us and get some resources to help do that, because we see it coming. I think nonprofits are really going to start to feel the pain 6 to 12 months from now, when everybody who has been funding during all of this time has spent all of their funds instead of saving some for the long haul. And so we're trying to kind of plan and keep that in the back of their minds as well.
It was interesting when PPP came out, how many of our agencies did not apply because they were kind of taking a wait and see attitude or felt like they were okay for now. And we had conversations locally, like, how are they going to feel in October, in September, when this continues? And they're not, and they're, the funding is going to be much more critical for them at that point.
So I heard collaboration, this theme of collaboration come up as a few of you were talking, and I want to take that one step further, not just for the nonprofits, right, but just across the sector in general, right? Again, as we think about recovery funding and investment. Patty, can you talk a little bit about, just kind of kick off this piece of the discussion around collaboration across the sector and what that potentially means from a funding investment standpoint long term?
Yeah, thank you, Qadira. I feel that collaboration, this is an interesting moment in time. We're having a lot of companies come forward and be really involved in wanting to be part of the solution. This movements of connectivity of the COVID response, the racial justice movements, it's forcing corporations to kind of lean in a little bit. And I think what we have to do related to collaboration is say that money and social media messaging isn't enough. that we need to really push them to say, we need you to be part of the solution overall. Government has to be part of the solution, nonprofits part of the solution, but so are corporations. And some of that's internal. Are you paying a living wage? Are you taking interest in the communities in which you're based? Are you giving better benefits? I mean, I just heard a story this morning about how many people have lost their insurance because of layoffs. I mean, it is an enormous burden that, a lot of Americans are holding right now. How do we have a responsibility across all of us to kind of hold up what we need and what's needed by everyone. Additionally, then there's the consumer side of it, which is, what are you giving back to the community at large? How are you actually taking your responsibility seriously? And what might that mean? And I think we shouldn't underestimate that companies do have an incredible ability to influence. They influence the narrative, they influence what people are thinking. And so I'd like to see more action come forward. I think some are doing that. I mean, shout out to Target for increasing their, wage across the country to $15 an hour. I mean, that's incredible, but I'm not a Target employee. I don't know if that's enough. I doubt it is, but it still sets a tone for everyone else to kind of follow through on. And I feel that we need more of those actions coming forward. I do want to say, though, for CDP, we have seen a lot of corporate giving into COVID-19. We have seen a lot of desire to give back to communities. Foundations, family foundations, for the most part, have tried to stay a little more local, which I totally respect and understand. They have tried to work on their communities, but we need to see those collaborations are going to become very important now as the crisis is continuing. We are not at the point where everyone can say we're in the recovery phase. We are still in some states very much on the rising. Unfortunately, we are not flattening. And this is, Ashley's point is how much funding is going to be left after we've finished with the response? How much is going to be there? And 2020 is going to be the year to dig deep. We're going to need everybody to give more than they've ever given before. We need people to really think about their sustainability. We, to Andy's point, we need collaborations. I mean, hibernation is possible for some organizations, but mergers might be necessary for others. A lot of this is going to need everyone kind of thinking it through and working together. And so collaboration for me is also just a lot of it is about being open to different ways of working, to exploring different ideas, thinking differently, and just giving more. And not just funding. Funding is one thing, but as I mentioned earlier, it's also giving your voice, amplifying messaging, setting an example and a tone of what's to be expected. There's so many ways we can give. And I think all too often we think about giving as like a number. And those who don't have then don't have to give, or, but or aren't recognized. Whereas I think the most generous giving in this country is often from those who have almost nothing to give but their time and a smile. And we need to celebrate that, because that is what's going to help us get through this complicated year. And it's going to help us come out the other end more positive and more optimistic about the future.
Yeah, if I could echo that just for a moment, we have a phrase here at the Greater New Orleans Foundation that everybody can be a philanthropist. And the biggest example of that is our Community Giving Day. And I know the Community Foundation in Texas does one as well. But we had a record-setting year here in New Orleans. We raised, about 20% more than we'd ever raised before. We had about 20% more donors. And these are donations that start at $10 a piece. And I think that it really speaks to the potential of the entire community coming together to celebrate the nonprofits. And when our backs are up against the wall, I mean, we were one of the first communities hit hardest from the COVID pandemic. And we shut down hard. People were out of work. And yet at the same time, people were willing to give the shirts off their back to help those nonprofits stay alive, because they recognized that day in, day out, those organizations are there for us and are the kind of organizations that we need when we come through the pandemic. We need them to be there. We need them to be strong. And it was a beautiful thing. And so I think celebrating that philanthropy is really important across the board. And then, as Dr. King mentioned, also being cognizant of the reasons the philanthropy is needed in the first place and addressing those underlying root problems that we've got to get after.
Mm-hmm. Wendy, would you add anything to that around collaboration?
Yeah, I think it's one of the things that we've really seen up here in Dallas and Fort Worth. Actually, it's in North Texas. Is when we began North Texas Cares, in early March, when we first started seeing cases coming in and fundraisers being canceled. It was, we started on a Tuesday with about 7 foundations wanting to get on a call. And by Friday, it was 70. And that included family foundations and all the local community foundations and 6 or 7 United Ways and corporate foundations. And the reaction was huge. Like, we need to come together and figure out how to make it easy for nonprofits. And that's where our platform came from. And so we launched about 72 hours later, a website and an online application. And within 3 days, had 300 applications. And within, we were getting on average, about 400 a week or something for a while. It was crazy. Yeah. And what we've seen is that it's the partnership of everyone from every sector coming together to really figure out how do we take what we bring to the table, where we can come from, and provide the support that works, that from this space from where we're at. And and what we found is that by having these kinds of collaborations around philanthropy, it's led to other kinds of collaborations. There have been some great collaborations with United Way and a lot of local nonprofits in the city and the county around rental assistance. And there have been some other collaborations around small business entrepreneurship and how do we, get some capital and leverage some money for small businesses, and even collaborations around how do we take displaced workers and line them up with nonprofits who need workers because they've lost volunteers and they've lost staff and they now have a higher demand, and link all of those together. And so, locally, it's been kind of the mantra, and I think it's led to a desire locally for even more opportunities for us to continue this working together. And I echo what Patty and Andy said. It is going to take all of us. We are all in this together, and all of us have to come from this place that we're at to try to support the communities that are still suffering so hard. We're in Dallas, Fort Worth. We're getting hammered right now. We're making national news for not the right reasons. And, there's just a lot of uncertainty and a lot of stuff happening right now, and a lot of folks that are just deeply, deeply impacted.
And actually, I wanted to make sure that you weren't trying to jump in, and I don't want to rush us by any means, because I think, what I'm hearing from everyone is it is going to take all of us. There are plenty of opportunities to collaborate. And, I think all the points that have been made are well taken, that new ways of working, right? That theme keeps bubbling up. So I just want to make sure that we don't fast forward past that conversation, because I think it's really rich. I think, Patty, you said something very interesting, that, even though this topic of the session that we're having today is around recovery, not everyone is in the recovery phase, right? And so I want to spend a little bit of time talking about, even the conversations that you all, and maybe each of you could talk about this, the conversations that you're having with your clients, your stakeholders about their investment, understanding that we're not all in the recovery phase. Ashley, can you maybe kick us off with that? Again, we see the country, we're trying to get there. We're trying to get to the recovery phase, but we're not all there. So talk to us about how you're shaping your conversations with your stakeholders, your clients, about this kind of interesting phase that we're in from a funding standpoint, and what's next and where we should be directing those dollars.
Well, so for us, we've been trying to move into North Texas Cares 2.0. So trying to figure out what does that response to long-term recovery look like, and working with the funders at the table to determine priorities, but trying to be cognizant of the fact that, we are not out of this emergency response. So while we know that we've put, as a group, almost $40 million out into the community to assist with the response efforts, we know that, we are peaking right now again, and that we could launch back into that need at any moment. And so we are constantly aware and bringing it to the forefront, at the same time just trying to figure out how do we plan. And I think one of the other things that we have done, and this has been throughout, and Wendy mentioned this earlier, but is to make sure that people aren't depleting or taking away from their normal grant processes that our nonprofits depend on. I mean, you can't rob Peter to pay Paul, right? Like we can't deplete those funds, whether it be through sponsorships or grants that a nonprofit is counting on year after year to say, well, we're going to deploy it now because of COVID. And so trying as much as possible to repeat that with our fellow foundations and corporations in town. And then again, with the providing operational support and being as flexible as you can. So if you did have a sponsorship that was out there and the event was canceled, how do you allow for the flexibility for that nonprofit to keep those dollars and not pull back on that? Yeah, I think it's really important for us to think about long-term recovery and talk to our partners about, that it's going to run the gamut now, and it's not going to look the same as what the response grants were. We're not going to be providing grants for food anymore. That now it's how do we get people the income that they need so that they can start buying food on their own, or paying for their housing, things like that. So really trying to figure out what those priorities are going to look like to help people rebuild and reimagine their future.
If I could
Really
come
good.
on.
Wendy, oh, yeah, absolutely. Go ahead,
Sorry,
Patty.
Wendy. I was just going to say, I really love, Ashley's point, because it's about, it's not either or, it's yes and. And I think, some of the programming, if you're really being open to the type of programming that you're funding, if you're really taking on board, that solutions coming from the community, some of what you're doing now as a funder is actually helping with the recovery because it's ensuring people aren't falling as far behind. And so, we have to keep that in mind as well. This is the first time, CDP has actually stood up a response fund versus, normally we do a recovery fund because we know when the media's gone home and attention's gone, people think the crisis is over, except those who are actually surviving the crisis, who know very well it's going to take several years yet to fully recover. And even in this crisis, everyone's part of it, but not everyone is affected to the same degree. And I feel that the more we can put into the response phase in creative programming that helps communities, that is set by communities, where they know where they're worried about. Is it small grants to help them continue? Is it about assistance for education? Is it, whatever it may be, that we're helping people not fall as far behind as they may. And thus their recovery hopefully will be shortened. And so I think there is for me, it's just a yes and I do think we are going to need it. The other thing is people just want to put out there, a lot of folks, the narrative is when the vaccine comes out, this is over. And I think we need to make sure people understand it is far from over when the vaccine comes out. There will be no new normal of COVID-19 after the vaccine. It will be, for many people, still years of recovering. They have lost their homes, maybe they've lost their businesses, they've lost their livelihood, their child has fallen far behind in school, they've been victim to a domestic violence increase. We know mental health issues are going to be exacerbated. The list goes on as to how different people will be impacted. And it's not a checklist, it's not an either or, for some it's yes and for that as well in terms of how they're impacted. And we need to stay creative in finding solutions and working with communities, and we need to keep the money coming and going into COVID recovery because it will go beyond the medical in terms of impact, and it will go beyond the medical in terms of solutions. And we need to really keep that narrative alive in how we're talking about it. And all organizations, everyone who's been generous to date also needs to keep that in mind, because there will be other crises that come up that people think they can just replace. And here's a hurricane or here's a earthquake. Now that's our focus. No, it's similar to the racial justice movement right now. It's end. And we need to look at them together. And it seems the burden is too much to bear at times. It's a lot, but it's important and necessary if we're truly caring about communities, if we're truly caring about their recovery, that we keep that longer term focus. And we appreciate that this is going to require heavy focus and attention from all of us over the long haul with them to ensure that we get through this together.
And Patty, I appreciate your connecting both the COVID-19 crisis and then the protests for racial justice, because this question, and as you talked about folks not getting pushed too far behind, we know that there are thousands and millions of Americans who are one paycheck away from being without any money. They've got average savings accounts of less than $400. And that's particularly true for communities of color. And it's also true for institutions, whether they are small businesses run by individuals of color, families of color, or nonprofits that are minority led. And so as we're thinking about how do we keep people from getting left too far behind, we've got to recognize and be cognizant that assets aren't distributed equally presently. And so when we ran our family assistance program, we were intentional about two things. One is that we were supporting families with a direct grant program. And two, it was families who were making 80% or below the median area income. And so the average family that got grants from us had a family income of about $27,000 or less. And that was, just not that there weren't other people who lost jobs, who were losing income, who were facing difficult challenges. There were millions of them. But with our limited resources, we tried to prioritize the families that were most vulnerable. And those were, not individuals, but families, with children and who were income constrained before the pandemic began. I think as we think about that frame, that's the frame that we need to keep in mind, because in order to have these organizations and families come through the pandemic, they're going to need a lot more help because they have fewer resources to access right now. I used to say this all the time. In Katrina, everybody got flooded, but those who had bank accounts and world-class skills were able to make their way more successfully to the other side. Those who did not have world-class skills, who've been left behind by our education systems, and who didn't have assets in the bank, their struggle was compounded. And we're going to see the same thing here. And that's why it's so important that we address it head on intentionally.
Wendy, you look like you wanted to jump in as well in regards to, go ahead.
I just wanted to say, I just completely agree with everything that Andy and Patty were saying. I mean, we see this locally as well. We knew before the pandemic that communities of color were significantly making less money than the white population in Dallas, that where you lived in Dallas County matters almost more than anything else, that where you're from is really a better indication of your economic future than almost anything else. And by seeing and when the pandemic we know is what we're doing is exacerbating that issue. We say something similar to what you said, is that what a natural disaster does is it actually just uncovers the poverty and the deep poverty that already was there. And so for folks who are already struggling, the hole that they're in now is even deeper to even just to get up to ground level. And so we feel the same way, that our focus has to be really intentionally looking at how are we sustaining and supporting and reaching into those communities that were already struggling before the pandemic, that we know are going to be even more resource constrained now, and where there's even less capital, there's less assets for them to even pull from.
Yeah, I think, it's interesting that to hear the conversation about natural disasters. A few of you have referenced that. We're in the middle of hurricane season, right? And we expect it to be active. And, we're living through a pandemic. There's continued need for response, recovery. We're living through, civil unrest and racial injustice, and funders are attempting to address some of those issues. I want to have a little bit of a conversation around, as we focus as a country and from a funding standpoint, we focused on COVID and we focused on racial inequities and social justice. What is that going to mean from a funding standpoint for those natural disasters? And Andy, I want to start with you, being there in New Orleans and having, managed through Katrina, for example. So you've kind of been there and seen so much, at the front seat. Talk to us a little bit about, there's a lot here compounding. And again, as we look at it, it's just going to take one catastrophic hurricane, whether it shifts our focus away from our COVID recovery needs, or are there going to be communities that aren't going to get the attention they need in a natural disaster response, because we are rightfully so focused on this COVID recovery needs and other things that are going on in the country. So talk a little bit about what that potentially means as we also face a very active and potentially catastrophic natural disaster season as well.
Yeah, I mean, I think we have every reason to be fearful. And to Patty's point earlier, this may be a year, not just because of the COVID-19 pandemic, not just because of the civil protests for racial justice that we've been seeing, but we may have other natural disasters that compound these problems that are going to take resources. They're going to take resources from private philanthropy. They're going to take resources from the government. And we're going to need to be leaning into those things if we're going to be able to be successful in responding to them. And I hope and pray that we don't have one of those major hurricanes, but we've got to be aware of it. And of course, right now, organizations across the Gulf Coast and other vulnerable communities are planning. How do you do an evacuation with shelters being set up in a time of social distancing? You know, we can't just go to the school gym with, fill it to the gills with cots like we used to. And so what are the different strategies? There's a lot more vacancy in hotels, so that we've got, other options, but those options need, to be planned for. They need to be creative. We need to be creative about it. And I think the better we are, this is true whether it's with a pandemic or a hurricane, the better we are for preparing for the worst, the more successful our response and our recovery are going to be. And so there's no substitute for preparation. We've got to do it. We've got to plan for it. And planning for it, Qadira, of course, means thinking about the resource constraints and positioning ourselves mentally to say, you know what, if what we need to do is spend more, we need to spend more. And that, again, is both philanthropy and governmental sources.
Absolutely. Ashley, I want to, turn to you because I think so many of us across the country were clinging to some type of, hope coming out of all of this. And I wonder if, even from a philanthropic standpoint, and as we look again at recovery investment, is there any sort of silver lining that you've seen across the sector from a philanthropic standpoint, again, as it relates to the sector of pulling together collaboration? Are there any silver linings in all of this?
I mean, I think the biggest one has been the collaboration that we have seen across the sector, especially the philanthropic sector, of coming together and co-funding projects, and DFW having 33 funders use one application for emergency response. Like, that was huge and unprecedented, and we did it in a couple of days. We made that happen, and knowing that all of those funders are still at the table and wanting to create the next common application for long-term recovery, and even considering how we can have a common application for years to come, like that amount of just collective care across our foundations, it makes me excited every time I talk about it. Like, you can tell by the smile on my face, because it's just been something that we have not seen here before. And I think that it is going to create an entirely new way of working in Dallas, Fort Worth, for our foundations, for our nonprofits. We've even brought nonprofits into our conversations on how do we structure this next phase of a common application. So I think silver lining is that overall, we have shown that in times of crisis that we can do hard things, we can create new things, and we can do it quickly, and we can do it well. And how do we continue to innovate moving forward so that we don't continue with business as usual, but we reimagine what we want our community to look like? I think that all of the events that have occurred during this time are giving us that opportunity, and that's our silver lining that we need to grab hold of and take advantage of right now.
Absolutely. Yeah, that is great. Patty, I'm going to ask you to also jump in here from a recovery standpoint. Silver lining?
Yeah, well, I mean, first, I really support what Ashley has said. I think it's forced organizations to move beyond competition, and I really, value that collaboration. I want to take a bit of a 30,000 feet view on this in a sense, though, which is, I think it's given us an opportunity here to tell a narrative differently. You know, we have, everyone now understands how to be, what being impacted by a disaster means, the inconvenience, the devastation, the challenges, the uncertainty. Everyone understands now. And I think it's always been, from Center for Disaster Philanthropy's perspective, complicated because people will think disaster is just something off on the side. It's maybe affecting coastal regions or fire areas, or it's just not everybody. But now it is everybody. We all know what it is. And we have a chance to kind of seize on that narrative and get people to understand it, to really possibly increase funding for mitigation, increase funding for preparedness, get people to recognize that you don't have to see the return on investment to recognize the value of giving in those periods, that there's an Achilles heel to whatever it is you might want to do. Maybe your focus is on philanthropy and the arts. Well, you know, even arts are impacted right now by this crisis. So how do we ensure that that giving is more robust and more secured? And that's so one thing I think is just on that values. How do we make that message clear so that those areas, those regions, those communities who are often more cyclically impacted can call upon everyone else to be more in it together over the long haul. The other thing just relates for me to the methods of working. And I, for years, have been challenged by, you know, conferences and events and everyone flying all over, and we close off huge amounts of our work to others due to cost, due to proximity, due to, you know, access for however it may be. There's so many ways we have closed off opportunities that I think we are now forced, even through this very event, to recognize, you know what, we can work differently. We can make things more accessible. We can create opportunities. We can be part of a solution of equity and inclusion. And to, I'm really hoping that we continue that we don't go back to it and say, well, you know, we're going to go back to the way it was before, but actually we're going to recognize that there were a lot of value adds in changing the way we worked in conferences such as this, in allowing remote work for people who have small children, especially, not necessarily with their children at home all the time, but in general, recognizing that there's a lot of impacts and challenges for everyone, and kind of taking a willingness to see into the personal situations we all may have. And as employers and as colleagues, empathizing and recognizing that and being a bit more patient with each other. So I'm just hoping that we have a few things that we take from this in a positive way and bring forward into our society at large in the future.
I think that's great. And I think, you know, I'm going to jump to, because I think it's timely, a question that we got. Now open it up for whoever wants to answer it. We've shared a lot of really good ideas, recommendations, suggestions, lessons learned from the past. But funders, you know, we're all looking for ways to measure, right? And so one of the questions that I'm going to throw out to the group is, what sorts of tools do you use to determine which long-term pre-disaster mitigation measures to support? Is there a role for community resilience benchmarking? Again, from a funder standpoint, we all know that measurement benchmarking piece is so critical. Would someone like to jump in and maybe address that, or kick the group off in addressing that? Again, a role for community resilience benchmarking. Is there a role?
Yeah, I think that the best definitions I've seen about resilience don't just include physical resilience. And, you know, in New Orleans, that means, you know, how strong are our levees? How robust is our coastal marsh to be able to keep the hurricanes, you know, and whittle them down before they hit our populated areas. But resilience really, in a true sense, is not just physical, but it's also social. It's individual. So the question is what are the savings accounts of our families, right? Mm-hmm. What are their skill levels, right? What are our small businesses' assets? Because when we're coming back, again, it's all, Qadira, as you mentioned earlier, it's what folks have to rely on to get them through. And right now, those are measures of resilience, just as that levy is a measure. So I think it's really important that communities identify and have strategies around saying, these are the things that we think are important to having a strong, robust community. My favorite story of social science a while back was an essay somebody wrote about a heat wave that hit Chicago. And there were 2 senior centers in Chicago that were affected by the same heat wave at the same time. And there were a bunch of deaths in one and almost no deaths in the other tower. And the question was, well, what was different? And it was actually the support groups that worked in the tower. So, there were organizations who were checking on our neighbors, and those who were being checked on actively got the assistance that they needed to survive. And those who weren't, who had a weaker social system, did not. And so that's another measure of resilience. So we think about community resilience. I think those are good things for us to be measuring. The hard thing about it is that those are measures that don't change quickly. And so the benchmarking is important, I think, to guide us. And funders ought to be asking, are you investing in things that are going to change those benchmarks? And what kinds of impact are you having at the things that will change those benchmarks? The downside is that they change slowly, and smart investments over time only make marginal differences sometimes in the near term. And so we can't have funders who walk away and say, well, that's a bad strategy because we still have a lot of poverty. The answer is we probably actually need more investment, both from philanthropy and from public sector resources, so that we're consistently working on those same things. But I think that the idea of having those community benchmarks for resilience is really important as a North Star for our work.
Really good. Wendy or Ashley, Patty, anything that you all would add to that?
I completely echo what he's saying. I think that we've done some data locally that were benchmarks, and what we've learned quickly in March is that even our benchmarks suddenly went off the table because of COVID. That it just even the I saw the same news report that Patty did about how many people have lost insurance. I mean, and I think the important thing what Andy's saying that we all need to remember is that we can have community benchmarks to measure, but this is a long term. I mean, if we're even before COVID trying to measure economic mobility, it's a long haul. You've got to be willing to follow and fund for 10 years or longer. And this is another case where it's just going to take us, we can benchmark now, but we're not going to be out of this in 2021 and 2022. This is some of the conditions in these communities, in some cases we've taken some step backwards, and we're going to just have to really be in it for the long term. It's a long-term play. A lot of patience is going to be needed.
And if I could just add to Wendy's point, I think we also need to be cautious because we can't set the benchmarks. We need to work with the communities, as is mentioned. What is working for them? I mean, Andy's example is perfect, but that also is going to take time. And we're not going to try and do that in the midst of a pandemic, right? So, I mean, I think there's a lot that we need to be open to in terms of letting the community set their own benchmarks, letting the community tell us what the needs are, and us being open to learning from that, accepting that, using the collaboration, like Ashley mentioned, all these groups coming together and, okay, great collaboration on a grant mechanism. Well, let's have a collaboration on what we're actually going to also, how we're going to work with these communities, how we're going to judge our impact with these communities. So I think there's a lot of reflection and we need time. I'm not saying time is an excuse. I'm saying time as if we're going to do it right, we need to be more forgiving with ourselves about how quickly we're going to do it and how quickly we're going to change.
Well, I would also, just to jump in too, I think there's a role that philanthropy plays, and then there's a role that government plays and policy plays. And that what we have to recognize is that philanthropy cannot make up for a lack of policy. So if there's not a policy, philanthropy cannot fill that gap, and that we have to figure out how we work in partnership and in collaboration and coordination. And it's whether it's supporting communities to be able to advocate and drive policy change and support communities driving policy changes that support them, or it's working alongside and figuring out where does philanthropy come alongside government. As Andy said earlier, we can step in earlier and we can fund pilots and we can fund demonstrations and we can put early dollars in, but where we don't necessarily, and give government time to catch up.
That's what I was going to add. It's more than just investing in this. It's advocating for systems change. We need to not only the philanthropic sector, but we need our corporate sector to lead and model that acknowledgement that our systems are broken and they're structurally racist. And we need to advocate for systems change right now, because that is going to be a major determining factor in the resiliency of individuals and our communities. That advocacy is important. And so investing in advocacy, but also advocating as a corporation, use that voice that you have, because that's huge.
I think it's interesting to see that in just the last couple of weeks news, the change in the Mississippi state flag, the leadership. I mean, there was a statewide vote less than 10 years ago to reaffirm what was then the state flag. That's changed, and the governor of Mississippi said it was because of corporate pressure. The Washington football team just announced their mascot change from the Redskins. And it was clear that was because of corporate pressure. To Ashley's point, there are lots of different ways that as philanthropy, as governmental actors, especially as corporate actors, we can use our voice. I think that one of the things that gives me hope is that right now, the COVID pandemic and the activism for racial justice has come together to cause people to move in ways that they had not moved and made a difference. It is no time to stop. It's a time to press fast forward on that. There's a lot more that needs to be done, but at least there are hopeful signs that there's greater recognition about those systems that are systemically racist in our communities that need to be changed. And there's people who are standing up and taking action. And again, and those of us who are white leaders of organizations, as Patty indicated at the outset of the conversation, we need to be doing a lot of listening and a lot of following folks who are on the ground, who've been in the fight on the front lines.
Now that's really rich. I mean, that's a separate conversation we could spend probably another hour on. And unfortunately, we're not able to do that. We have about 2 more minutes. And, whether it's a continuation, Andy, of the comments that you were just making, I'd like, each panelist, if you will, to maybe close us out with just, 30 seconds, 45 seconds of advice, right? 5 to 10 years from now, as we look back, and we'll still be talking about COVID just in the same way that we're still talking about Katrina. Maybe give some advice, just closing out. Andy, I'm going to start with you. 2 to 3 things. What should we be thinking about from a recovery standpoint?
I think it's simply the kind of world that we want to create, and making the size and scope of investments to create that world. We used to say after Katrina, we know what it looks like when the United States is in a fight for its heart and soul. That's what it looks like when we're in Iraq, when we were throwing all the resources we had at that fight. We need to throw as a country, as states, as countries, as philanthropy, as corporate citizens, all of the resources that we've got to address the situations that led to a pandemic and that led to the inequities that are being protested across the country. And if we do that, in 10 years, we'll be able to see substantial progress. I'm optimistic, but it's not going to happen unless we do our part.
Ashley, what about you?
I think it's going to be important to remember and capture this moment as we look to reimagine where we want to go and what we want our community to look like in the future, and to make sure that we put our money where our mouth is. Like, start partnering with the grassroots organizations, make sure they're at the table, make sure your application processes allow for them to not only be eligible for funding, but to actually access that funding, and make sure that you are funding those organizations that reflect the communities that they want to serve. Put all of your comments and social media into action. I think that's going to be the thing we've got to hold on to.
That's powerful, Ashley. Thank you. Wendy, what about you?
I would agree with both what the other 2 have said, but I think that this is a moment that every one of us can do something from where we are. That it's, even if you don't have a ton of money, that you, as Andy said, anybody can be a philanthropist and anyone can be a part of something, and that this is the moment I think for us to really look at what kind of society, this is the chance for us to make some choices about what kind of society do we want to have. And all of us have a chance to have a say in that and to participate in that in some way, even if it's, you know, writing cards and mailing them to a nursing home because you want people to know that they're being thought of. I mean, small gestures right now have huge impact, and that all of us from where we're at can do something. And this is the moment to not sit passively by.
That's great. Patty, bring us home.
Yeah, so I think everyone has kind of said it. I mean, the way I'd frame it is just, you know, we have to keep our eyes on the prize of a better society, and we need to recognize it takes us all to get there. And, you know, the time of sitting on the sidelines and saying, well, it's not me, I'm not impacted, and kind of resting on the privilege of not having to be part of the solution, it's over. I mean, we really need to, you know, all take responsibility, all give in however we can give. No one person, no one corporation is responsible to fix all the problems that ail our society, but no one has the right to sit and watch it from the sidelines. We all have to do what we can to help and really challenge ourselves about what that is. And we need to be comfortable with that fact that that's going to make us uncomfortable in many ways. And that's kind of what we need to do to come through this and be a better society for it. So I'm really hopeful for this moment in some ways that we will all continue to do that, and just really thankful to have the opportunity to talk about it with you and everyone else, and to hear and learn.
This has been great. I am so sad we're all out of time. It was a fast hour, but Ashley, Wendy, Andy, Patty, want to thank you for joining the conversation. It was a very interesting, rich conversation virtually, and we've got more work to do in our COVID recovery. So just want to thank everyone. Hope that all of the attendees enjoyed the conversation, and feel free to reach out to any of us if you have additional questions. Thanks, everyone. Have a great rest of your day.
Thank you all.
Thank you.
Thank you.